You are free to put any questions or comments in the chat as we go through, and we leave it up to each individual speaker to address them in real time or to potentially save them for later in the session upon conclusion of their individual presentation. So without further ado, I would love to introduce Yvonne Richards, the Director of Education and Research for the Center of Rural and Community Health at the West Virginia School of Osteopathic Medicine. She will be kicking off the didactic presentation, which will be the second in our Grants 101 series, which will continue over the next couple of sessions for Design Studio, focused on kind of the how-tos within the world of grants. So I will hand things over to Yvonne and take it away.
Thanks. Thank you guys very much for allowing me to present today. It's very nice to see everyone. Happy Friday. So the topic for today is called Building Bridges, Leveraging Community Partnerships for Successful Outreach.
I hate to interrupt, but I can't hear you very well, Yvonne. I just want to let you know.
Yeah, Yvonne, it's a bit muffled for some reason than when we previously spoke, so you've got time to troubleshoot here.
How's this? Is that better? Okay, switched mics. Okay, so our agenda for today, we're going to introduce grant initiatives. We're going to understand the grant preparation process. We're going to look at the importance of community partnerships in the grant process. We're going to identify and engage, talk about how to identify and engage community partners. We're going to talk about collaborative proposal development. We're going to talk about tips for effective community collaborations. And then we're going to look at a case study with the Greenbrier County Health Alliance of an example of what other communities can do. So just to begin with, we all pretty much realize that health outcomes are very much affected by local social determinants of health. I mean, I think that's a recognized issue, and most grant opportunities that come available now also see that, and they know that those barriers have to be looked at in order to provide a successful intervention that has good outcomes. And I wanted to talk about a specific grant that came up last year, just as an example. And it is the CDC Strategic Approach to Advancing Health Equity for Priority Populations. And so this, again, was a CDC grant that focused on decreasing the risk for type 2 diabetes among adults at risk with prediabetes. It looked at improving self-care practices, increasing the quality of care offered, early detection of complications with CKD and diabetic retinopathy screenings among priority populations that had already had a diagnosis of type 2 diabetes. It looked at support and implementation of a family-centered childhood obesity intervention to reduce the risk for type 2 diabetes development, and also to increase public health workforce capacity with a community health worker development and training. So the CDC identified specific counties as high risk in this grant, and this was based on socioeconomic and other risk factors. And one of the short-term outcomes in the logic model that they had in the NOFO was to increase the number of organizations implementing evidence-based community behavioral change programs, which I thought was interesting. So this grant really sought to increase multi-sectorial partnerships with a community component. And really an interesting note about this grant was that the service area had to span 350,000 people. So when you're talking about a rural state like West Virginia, you had to have 6 counties included in that application process. And that required a huge network of collaborators across multiple counties. So in understanding the grant preparation process, we're going to talk about the key stages, which is research, planning, writing, submission, and evaluation. And I've got a little bullet point here on emphasis of thorough needs assessment, because that's really where it all starts. Conducting the needs assessment with community collaboration is the first critical step in that grant research stage. The community can provide input and unique insight into both the problems as well as the solutions that the data just doesn't give. And it can also help to ensure that the project's going to align with the grantor's objectives with that project. So the goal is to use community input along with the data and the evidence gathered to support the existence and the significance of the need. So let's talk about importance of community partnerships in the grant process. We do this because it enhances the proposal's credibility. It leverages local expertise that we may not have within our organization. It addresses authentic community needs based on that community's social determinants of health. It helps to build culturally competent programming, and it makes the project sustainable. And we know that a lot of grantors look to see, is this something that's going to be sustainable after the grant dollars run out? So community partners enhance the credibility of the grant proposal by demonstrating that the project has local support and that there's an understanding of the interventions chosen, that they will be more successful. An example could be if a program is trying to improve health behaviors of a low-income community, we could use focus groups to hold talks about what barriers exist for them to get routine screenings and checkups. And so through those communications, you may learn that transportation and trust are two big barriers for individuals, and that's why the screenings or checkups or rates are down. And so you could host a mobile event and even have events at a local faith-based organization or an organization that already has community trust. So identifying and engaging community partners, we want to target relevant community organizations. Again, conduct that good needs assessment. We want to develop mutually beneficial relationships, and we want to ensure diversity in our partnerships. So again, relationships are really critical to the success of engaging community partners, and it really should be built way before the grant ever is considered. Often the grant timelines are so short that it's impossible to develop the relationship that you really need to get buy-in and be successful in your project. For us, we try to identify all the sub-communities within the larger geographical or social communities that exist so that we can have that diverse representation, and then we just bring everybody to the table and have open conversations. So those conversations really reveal to us the resources that we may not have known about prior to the conversation. And then also it helps, again, to align those goals and objectives from the community meet the grant objectives. And their inputs also help us guide the needs assessment and the project design. So let's talk about collaborative proposal development. We want to align project goals with community priorities. We want to integrate partner input in the proposal writing. We want to showcase the community involvement within the strategies throughout the grant. And then we want to demonstrate shared responsibility and ownership of the project. So again, looking at that CDC grant, it contained a menu of strategies that applicants could choose from in their submission. And each strategy required some kind of a collaboration, such as the community-based behavioral change programs, the community health worker program, community-based childhood obesity initiatives. And we looked at a couple different models that community engagement models that we could implement for this project. And one that came to mind was the community-based participatory research model. And this acknowledges that communities are equal project partners in each project. So the community helps to shape and define a specific problem, the research question. It builds on community strengths to create a culturally appropriate intervention, and then communicates the balance of power. And that's important. Beginning with a clearly articulated project proposal will help start that dialogue with communities. And we'll be able to capture the community priorities as well. Another model to look at would be translational research, which has really gained momentum lately with NIH in particular. One of the components of translational research is the movement of that scientific knowledge into the public sector. Research on translational research has suggested that the lack of collaboration between communities and physicians and academic researchers is one of the major roadblocks to translation. And they note that historically, most physician care occurs in the community, while most clinical research occurs in an academic setting. And so this makes implementing the findings into everyday practice challenging. And so this is one of the reasons why the PBRs are so important, and they really should be thought of as a community partner when you're looking at a grant application. So this is a new research model that we're going to start looking at and move to in the CRCH. It's from the National Institute of Minority Health and Health Disparities. And this framework has a multi-level, multi-domain model that has a wide array of health determinants that provide a greater understanding of health disparities among populations at risk. So as you can see from the graphic, it just helps you visualize the domains of influence that can either promote or worsen health outcomes. And it includes behavioral, biological, the physical built environment, socio-cultural environment, and healthcare systems over the lifespan of an individual that ultimately impact the community. So we can follow these domains across on an individual level to the interpersonal, community, and societal levels to get a better understanding of what's going on there in that community, and to be more equipped to address the complexity of health equity. So what are tips for effective community collaboration? Again, we want to build trust through transparency. We want to establish clear communication channels. We want to always involve partners in the decision-making process and solicit feedback throughout that whole process. We want to nurture long-term relationships that last beyond this particular grant and to move into the next project together. So we need to be willing to adapt the design of the project so that it works with the community that we serve. And this really comes through effective communication. So again, to put this in a real world context, let's say we design a program based on literature stating that more community members complete screenings when providers become accessible in their local communities. So as a result of this finding, you decide you're going to develop a program that hosts a weekly clinic in a local site that's easily accessible. And you invite medical professionals in to use that facility. So you run the program and then you look at the data and it doesn't show what you thought it would show. Bringing community forums again, or soliciting input from the community on why this might occur. You find out that people can't afford to take off work. They have to pay for childcare, and it's very prohibitive for them to come to the clinic in the hours that you've established. So one workaround for that would be to have evening clinic hours, weekend clinic hours, and offer childcare, and then go back and look at your data to see if you have an improvement in that. And so our case study, we're going to look at Greenbrier County Health Alliance. So for over 5 years, WVSOM has received Benedum funding, and we established the Greenbrier County Health Alliance, or GCHA. Working in conjunction with the WVSOM, GCHA is now a local nonprofit that works to reduce health disparities within Greenbrier County and really Greenbrier Valley area, which encompasses part of Monroe, Pocahontas. GCHA has an intensive local partner network made up of healthcare clinics, the Committee on Aging, behavioral health agencies, the county commission, local health departments, the Board of Education, local nonprofits, and citizens of the county. Some of the outreach initiatives that they have is, well, one in particular is the Greenbrier County Community Ambassador Program, or CAP. The CAP program develops local leaders and provides expertise to the community with a health and research focus. So many grants are provided through the CAP program, and CAP members develop and implement outreach programs that address specific concerns identified within the community. So data is collected on each of these projects, and that can help us inform a larger grant application. We can show you that we've already got success in a particular area. And it helps to increase more relationships and a wider reach for the CRCH. So a couple examples, we had an arts and recovery project where women with an SUD were provided studio time within in Carnegie Hall, and they were given instruction on therapeutic pottery making. We had a local and very rural community center has an adult playground that's offered to their people in their community free of charge as in an effort to increase physical activity. And I've been there and gotten on the playground and loved it. We implemented a Carrot Club program for youth in an area in Alderson that's actually in a food desert. We created the Meadow River Valley Collaborative Garden Project. And then we also established a non-food pantry in the Rennick Community Center because SNAP benefits don't pay for toilet paper, paper towels, diapers, that type of thing. So that's been very successful. And this is a model that you could use in any community. So this would work and already create that infrastructure, research infrastructure and partnership network that you need to move forward. And so thank you for your time, and I will take any questions that anyone may have. I think there are some chats.
No questions, but fantastic presentation and wonderful practical advice.
Thank you very much.
Yeah, Yvonne, this is Jennifer Boyd. It's always so inspiring to me to hear what's happening in Greenbrier County. Could you talk a little bit about, to me, the one critical piece of what you said was, having those relationships established before, not waiting till a grant comes up. And yet, when you just laid out what the Greenbrier Valley Health Authority is doing, it covers such many communities there in the Greenbrier Valley. And so can you just describe a little bit how the relationship building was conducted in the get-go?
I think so with that project, they identified stakeholders within the Greenbrier Valley area that they thought would really be needed to represent each sector of the population, like youth, the health department, and just all sat down at the table and develop this network. Mm-hmm. And so, anytime you have an idea or a project idea, they meet regularly. I think it's once a month. Julian Levine is actually the executive director of the Health Alliance, and he also works here as a population health director. And it just gives that format for someone to present a product or a problem or opportunity. And then we research what grants might be available and develop the project from there.
Thanks. So proactive. It's really exciting.
And very easily replicated.
I kind of want to see a picture of the adult playground.
I should have gotten, let me see if I can pull some up. Because there's like, like a seesaw, there's a.
Is it a big swing, a little swing? I can't.
Oh, it's huge. They're huge.
Yeah. Okay.
Let me see if I can pull anything up here.
Good old-fashioned fun. Those are the basics, of course.
Yeah.
And it gets heavily used. We had our local or our departmental strategy meeting there last year and just stayed outside and had a blast.
Sounds so much better than going to the gym.
Oh yeah.
It just.
And everyone is free to add any questions or comments directly into the chat, or you can take yourself off mute and just join discussion as you please.
Well, I can't find photos, but I tell you what, I will definitely get those and send those to you.
Thank you. But it's great that you can make interventions at so many different levels and just keep building in different ways. That's the part I'm really impressed with. So that's,
well, thank you. I mean, that CDC grant, that really, when you thought about like we had the proposal that we came up with had 6 county coverage just to meet the population size that they asked for in that grant. And that's very tough for West Virginia. Just to say that you're going to be in that big of a service area is huge.
Yeah. Well, for any rural, I was talking to people from Montana and just you know, their one county is the size of about 10 of ours, and it just
Yeah.
and has about the same number of people. So
Wonderful. Thank you so much. Before we move on, are there any other questions or comments? Take that as a no for right now, but of course, there's always the option to continue discussions or collaborations, towards the end of this call or thereafter. We are happy to make those connections. So thank you so much, Yvonne Richards, for your
Thank
time
you.
and wonderful presentation.
Thank you.